Okay. This is the 15th, I swear, time to try to do this. My partner keeps texting me. Okay, so I'm not going to be signing. One, I don't have my phone holder. Two, I'm still exhausted from everything that happened this weekend, with the pain and everything in my foot. As you guys know, I've been dealing with severe pain, in the ankle, especially where the incisions are, things like that. Talked to Rowan's nurse Monday, and she said that if it didn't improve, to call in yesterday to see if I can get in yesterday or today, which the earliest I could get into the partner was today, 8 a.m. So that's last night, off and on pain. Finally at 1:30, it was not tolerable anymore. I couldn't sleep. I was in tears because it literally skyrocketed past a 10, which is usually my indication that there is an infection. And I warned Rowan that I have a high chance of having infections on the right side of the body because of what's happened after my heart surgery. So I had a feeling, increased pain, most likely an infection. When I tell you, damn it, I was right and I didn't want to be right, I'm not joking. So 1:30, we get moved over into the chair that I'm in now, the recliner. And then I finally fell asleep about 3:30ish. Woke up at 6, so I got about two and a half hours of sleep. They put me in long pajama pants, some of my Nightmare Before Christmas, and then a t-shirt. Went to the appointment. As soon as the nurse took off the bandaging, the dressing, you can see there was pus. A good amount of pus too. And sure enough, I looked at it, I'm like, damn it, I'm right. Then, who I talked to yesterday did not request an interpreter, even though I reminded her, because y'all know I wear hearings, I'm profoundly deaf. My partner is completely deaf. So, they had to use the VRI. Thankfully, it did not freeze at all the entire appointment. I'm glad for that. His partner was also trained by Dr. Rhodes, my favorite doctor, who did my left ankle almost 16 years ago. And so she actually had the same surgery done a year after me because she broke her ankle. So she knows exactly how I felt. Anyways, she comes in, looks at it. She goes, yeah, there's pus. Have you had fevers? Have you had chills? I'm like, I've had chills a couple of days. And my partner knew that I've been having chills, so we've been keeping like a blanket over me, things like that. I said, we've kept it elevated. I've kept off of it. I've done everything right. Which is true. You guys know that I do not put pressure on my foot. I'm following doctor's orders to the T at this point. She goes, okay, I'm going to go ahead and gently, and she did do it gently, push on the incisions because it was only on the outer incisions. And sure enough, it was warm. She goes, yep, you have an infection. Let's go ahead and do x-rays to make sure it's not the donor tendon, the screws that your bone will take care of on its own, or the 2 screws in your heel and that heel adjustment. They also washed it with the surgical grade antibacterial soap. So the nurse comes in to do that wash, and she goes, I'm sorry, it's going to be really cold. I'm like, I bet you it's going to feel good. It felt good. Because of how much pain I'd been in, that cold water and that cold soap actually felt really good on my foot. I told her, it feels really good. So we went ahead and did that, and then we put the boot on just to protect it as we went. I'm in my wheelchair as we went in to do the x-rays. Let me tell you, the most painful set of freaking x-rays I've had. outside of breaking my left ankle twice. And breaking my shoulder and breaking my back. We got that done. She comes back in the room and we look at the imaging together from back in January when we initially did x-rays on it. And I'm wishing I would have grabbed pictures of it. Because you can see there's a good chunk difference in the heel bone. Everything is looking great. You can see some healing already. She also looked at compared them from the 25th when I went in for my first appointment from surgery and then today. And you can tell that they're doing good. They're doing good other than the freaking infection. So right now the infection is only skin tissue deep. We're going to hopefully we can keep it that way, and hopefully it will go down by the time I see Rowan on the 8th. But I am she gave me some more pain meds because I did end up running out of the ones I had because I was trying not to use them. And I finally took a full one last night. I think that's what helped get me some sleep. And then she also prescribed an antibiotic. So right now my partner is picking up medications, all medications except for 2. One being my monthly injection, the other one being the Dexcom. We're still waiting for that to be fixed. My sister is dealing with a lot of pinched nerve pain right now, so we're trying to help her through it, and he's probably going to run her to the ER if it does not calm down, because she's struggling to move. But anyways, I do have some pictures to share with you guys. I did take some pictures. The only one I don't have is that bottom incision on the heel. But the gauze and the dressing that had the infection was the outer 2 incisions. But she rewrapped me with dressing and Coban, not A-strap. And then put a kind of like a stretch knit sock that they use for casting a lot of times over my foot, which I will tell you that's made a huge difference already as well. But the goal is to only use the pain medication at night so I can actually sleep. It sounds like my sister's home. But I want to give you that update. Look forward to the pictures.